Hi, everybody. Welcome to Conversations with Calvin, We the Species. Um, I've been with Diana, Dr. Diana Joy Ostroff. Actually, she's on the island of Oahu as we speak. And it's funny when you just walked away for a second and I'm looking at your tropical foliage blowing in the wind, that gentle, warm, tropical wind. Although it's getting warm here in Jersey. And you've been out in Oahu since 1989. And this is, as a matter of fact, we were doing quite a long session here, just getting acquainted. I didn't want that session to end, and because there's so much to unpack with Diana, and being out in Hawaii, one of my favorite places on earth, where they filmed one of my favorite movies, From Here to Eternity. We were talking about that, but Diana has been practicing neuropathic medicine.
Naturopathic.
Excuse me?
Naturopathic or
Natural. I'm sorry. Natural.
naturopathic. Yeah.
Okay.
You think
Naturopathic. My mistake. And traditional Chinese medicine, and she's got the Center for Natural Healing, and I mean that's right up my alley because I love this stuff because it's life, and there's so many elements to Diana that is life and health, and so we're gonna unpack all of that. Really special for me, and I was sharing some of my stories with Diana and my own discoveries without having her guidance, and dealing with some of the things that I have to deal with in my own discoveries. But I'm a health person. People know me as I push 80 in 2 months. This thing works really well. It's because in my own because not knowing Diana before this, but in my own little microcosmic world, the things that she's going to talk about, naturopathic medicine, is life, and it's a quality of life, and it's longevity, and there's so much to it because I live it and I breathe it. And the other nice thing about Diana is, and I'm thrilled to say this, you're a Jersey girl, uh, um, uh,
Jersey.
and which is great. South Jersey, I think that's great. So, my little monologue has now concluded. And Diana, why don't you take a couple of minutes and do a little background and intro, and then we're going to jump in to naturalhealinghawaii.com kind of things. Take it away.
Well, thank you for having me, Calvin. It was very interesting hearing about your life and your stories and the things you've been through. So thank you for sharing and for having me on your show. I grew up in Jersey. I left Jersey to study and started migrating west. And it was in my dreams to come to Hawaii. So after I finished medical school, my friends told me, nope, you want to go to Hawaii. I was just thinking, well, maybe I'll go to another miserable place because Oregon with the rain,
Ah,
44 days in a row was difficult. But, here it's such a gorgeous lifestyle and I breathe fresh air and I have an inside office too, but it's nice. And I feel like I can walk my talk a lot easier here than maybe other places in the country.
perfect. It's really funny. Listen. I've interviewed hundreds and hundreds and hundreds of people, and half of them have these fake backgrounds.
Yeah.
And
I
you
think
don't have a fake background.
it's
That's
fake.
real.
Yeah, you can see the wind blowing.
I know. I love that.
Yeah.
I'm staring at it, and I'm pinching myself. That's real. That's real. This is not. Yeah, I was just interviewed the other night, and a Jersey girl too interviewed me, and there's the Golden Gate Bridge, and it bothered me because there's no Golden Gate Bridge in Jersey, and it's a fake background. So, but anyway, so let's jump in uh, to naturopathic medicine and naturalhealinghawaii.com. That's the website. People should jump there, and we'll talk more about that. So, uh, to begin with, what's the number one health issue you wish people took more seriously?
Well, there's no one issue that I wish people would take seriously because every single symptom that someone has is a reflection of something deeper going on. So, for instance, if someone has an eczema or a rash or acne or something like that, we need to look at the internal body because everything basically starts with the gut. So the gut being 70% of our immune system, has a microbiome of 100 million neurons and about 100 billion, trillion cells within the microbiome. That is responsible for a lot that goes on in terms of digestion, assimilation, our immune system, our nervous system well-being, our hormones being balanced. So I always say, okay, so if you have a rash on your chin, and according to my studies and traditional Chinese medicine, there's a reflection of the large intestine here. If this rash is on the cheeks, it's a reflection of the stomach. If there's jaw pain, it could be a reflection of the stomach. So there's always signs that typically will lead back to gut health somehow. And the gut, of course, is directly connected to the brain via the vagus nerve. So everything that goes on inside the digestive system, everything we eat, every decision that we make about around food is going to affect our neuropeptides, and that's going to cause either stress, a stressful a disorder, or depression, or anxiety, or something that would trigger us to overeat. So it always ties back, but I don't look for a specific, there's no specific thing. It's like, I wish people took it seriously when their body is giving them signs. When the body talks to us, we have to listen. Like, for instance, even, our the impulse to use the bathroom in the morning. Our body makes one urge. It tells us one time that we have to go to the bathroom. And when we ignore it because we want to lay down and sleep some more, or we're busy, or we're driving, that causes problems in the gut that could cause an expansion of the intestinal walls. It can cause permeability, can cause ultimately toxic gut if it's something that a person makes a habit of. So I'd say just paying attention is the most important thing, and certainly not masking the symptoms with modern medicine, like over-the-counter medicine. If you have chronic allergies, rather than taking these allergy medicines that are just stimulating, they have some stimulating effect. So it makes people feel better and it makes people breathe better. But then the toxins that are causing these allergies just keeps on perpetuating, gets deeper and deeper in the body. And long-term use of any kind of over-the-counter medicine or any drug, it never heals the body. It only suppresses the symptom temporarily. So then people turn into like just an drug addict, which even over-the-counter medicine you can become addicted to. And that's a shame. So I wish people would take it more seriously when the body's talking. Let's pay attention because, we're a little cavalier when we're young. And it's like how you said, when something really goes wrong, then we start paying attention. But what I see in my clinic, when things go really wrong, it's much more difficult than if we would just take care of it when it's small. It's much easier to reverse.
So interesting. So interesting what you said, because and people who know me know that I've been so hypersensitized. Any minor little thing in my body, I listen to. And all these years I had AFib. The millisecond that I went into AFib, I knew it was an AFib. And of course, I've been studying all the things all these years that trigger AFib, So I don't even smell alcohol. That's a trigger of AFib, and you need potassium. I mean, so listening to your body, what you just said is it's so true. Um, how is your healing approach different from conventional medicine? That's a loaded question.
Yeah. Well, if you think about going to the doctor, typically, because I've been a few times in my adult life, there's a lot of waiting, and then there's a short time that's spent with the doctor. And typically, a medical doctor, in all due respect, they're busy people. They have a quota of how many people they need to see in an hour. But the difference is you go in, you have a knee pain, they give you a prescription for anti-inflammatories, and you leave until your knee is so bad you need an operation, and then you need a knee replacement, for instance, for the average person. With naturopathic medicine, when I meet with someone, I do a full-on interview. So I want to know about this person. I want to know where they come from, what their lifestyle, what their beliefs are, what's going on with their body from head to toe, because everything is related. So if someone is losing their hair or their hair is turning white prematurely, that's related to their kidneys. And then they say, oh, and by the way, I have back pain. That's related to the kidneys. And by the way, I have knee pain. That's related to the kidneys. And by the way, I stand all day for my work. That's related to the kidneys. So then I learn their hydration or dehydration habits. It's related to the kidneys. So all these different things that they're telling me about their health, they're all associated with one organ system. But then we learn that they also have a sweet tooth. So then we learn the sweet tooth that's correlated to the pancreas and spleen, stomach and small intestine. Oh, and they also crave sugar, and they also eat when they're depressed, and all these things related. And their pancreas doesn't work. And so I want to know everything, and so I can systematically create change with the body. Because knowing one, and then I need to know about their emotions. What's going on? Like, do you even believe that your body knows how to heal itself? Do you believe you can get well? What do you want? What are your goals? Are your goals to just put a Band-Aid on it? Because we could do that. I could give you a Band-Aid therapy, send you home, and I won't see you because you'll feel better with the Band-Aid. Or we can get the job done and get you back to your state of like optimal, and that's going to take a little bit of work, but it's fun to do that journey, because like you said, when you were losing weight, you have along the way, you have these great milestones, these great wins. You feel good about yourself. Every day you think about, wow, look at all the things I did good. I chose salad instead of chips. I chose broccoli instead of fries, whatever it is. We start feeling good about ourselves. We start affirming that, yes, I can. Yes, I can do this. One step, and I always encourage my patients, the 2% rule. If you can make even 2% shift in a week, and a 2% could be like this morning, I woke up, and instead of looking at myself in the mirror and all the wrinkles that I saw and all the cellulite that I saw, I look in the mirror and I say, I am really proud of you. I am proud of you. I'm here for you. I'm going to help you through this. We can do this, and have a sense of, feeling blessed that we have a body that actually still works to whatever extent it works. So even just a self-talk is so crucial. So my job is pretty big, because we're not just talking about diet, and we're not just talking about lifestyle. We're talking about changing people's whole mental programs around health and around how they feel about themselves.
Okay.
About even like things that they learned in their childhood that they're still holding on to, their paradigms and their belief structures, like thinking that diabetes is inherited. So maybe 10% of the diabetes tendency is inherited, but what's inherited is the lifestyle. And people, you go to family barbecue and they all eat the same thing, and that's what then the next generation does. So there's a lot of adjustments that need to be made in how we think about health. And even making diet changes, it's not that difficult if you do it in a systematic way for the right reason. So yeah, it's quite fun. I think it's a lot more fulfilling to do what I do because I get to know people deeply and I love people and I get to help people and I get to see their change, and then I get to meet their families because they send them.
I have to, I'm listening to you, and I could be a poster boy for a lot of your messages. And I mentioned this, and and what I'm saying is I so believe uh, in what you're saying and your work. And the whole naturopathic thing, I don't know a ton about, and I'll learn more. But bottom line, as I mentioned to you, I've been in AFib for 15 years and did everything that mankind can do. And then I took it upon myself, and I didn't have your help because I didn't know you a few months ago. But I used all my imagination and I took my body back 40 years as best I could to where it used to be before I had that thing. And then I bounced out. So what I'm saying, Diana, is what you're saying really works. I mean, I did some stuff on my own without any help, and even the little bit I did. So your message and the things you do, hey, it really works. Boom. Okay.
Yeah, I mean, you sometimes people need support.
Of course.
Not everyone has that same level of belief in their resources to figure things out on their own. And there's a lot of things that are complicated. With you, you had AFib, period. With my patients, they have 20 different diseases going on simultaneously.
Mm.
So I see the toughest cases because they have to pay me. So when they go to the RMD, their insurance covers. When they come to me, they pay for it. So of course I'm the last one that they go to, but eventually they need help doing it right because all those drugs, 15 different medications on top of 15 different conditions causes complication to the brain, the nervous system, and obviously the
Yeah.
gut biome, but every cell of the body.
Right. You're
I,
so right. I
you
mean, you're so right.
yeah.
I'm just saying I did something by myself. But what I'm saying is I so grasp and understand what you do because I, in one small little way, without just fumbling around, the stuff, it works. No meds, no no electricity to the heart, no nothing. It because you change your lifestyle around. And so what I'm saying, I'm praising you as much as I can praise. It really works. That's my message to people listening. Stuff works. You work. Okay. And the good segue question, can you walk us through a real success story of someone reversing illness naturally?
Well, I guess one of the hardest ones. Well, I have two. I'll try to go quick so I can tell you both. The first one, this man, I'll call him Patrick, walks into my office, 350 pounds. He had diabetes, high blood pressure. He had a condition called elephantitis, which is a parasitic infection of the lymphatic system. So he had parasites running through his lymph, his filter. His legs were like tree trunks, and I have a window from my office and I could see him parked his car and walking in. It would take him like 20 minutes to get one leg out of the car and the other leg out of the car. And he walked in the first day. He said, "Doc, you got to help me." and I told me a little bit what was going on. I said, Patrick, I think I'm going to have to refer you to a specialist. He says, Doc, I'll do whatever you say. They want to put me on dialysis. So he was about I don't know, week away from dialysis. And the magic words, I'll do whatever you say. So I put him through my process. And like you, he lost 100 pounds in 4 months, but he got off 15 drugs in 1 month. And when he would come to my detox center, he would, for the first several weeks, I had to bring him to my outdoor space because he reeked so badly of these toxins coming out of his pores from the chemicals. And, I didn't know he went off all those drugs that fast because I'll kind of, once they're with me, sometimes they get really brave. I don't recommend someone going off that many drugs that fast. I like to taper it off slowly as we change it. I mean, I gave him natural replacements, obviously, but so he was, in 4 months, he had lost 100 pounds. His blood sugar returned to normal, blood pressure returned to normal. His doctors had been telling him not to drink water because it taxes the kidneys. Well, that also causes severe kidney disease. He had severe kidney disease. So I had him drinking water. I had him going to the ocean for 1 hour a day and wading in the ocean, or just like go in there and move your body. I don't care what you do, walk or swim or tread water or just lay there, but you got to go in the ocean. And that guy, 4 months, he was good. He was great.
Wow.
Yeah. So that was one. And I'll just tell you quick another. So this man comes in with his wife. I'll call him Jim. He looks like a big, tall walking skeleton. He was tall like you. And he had stage 4 lung cancer. So they told him to go home and die. They couldn't do anything else for him. So I look at him and I'm thinking to myself, oh my God, the guy's going to croak any minute, So my obligation, I sat with them. He talked, and I gave him a protocol. I didn't know if I'd ever see him again. I felt a little guilty, even charging him. He comes back with his wife in 2 weeks. And again, didn't look much better to me, so he's sitting there waiting. I call his wife to the side. I said, I am really sorry. I don't think I can help your husband. He said, you already have, and we intend to continue. They had given him 6 weeks. So he worked with me for 6 months. And then he flew to Arizona to live they had a new grandchild. So in other words, he 10x'd what they gave him. But, I don't know how long he lived after that. I lost track of him. But the point being, he lived.
Wow.
And he gained weight and he got healthy.
Wow.
And yeah,
No,
pretty exciting
it
stuff.
works. It works. It works. It works. It does work. What is I'm always curious about this, a connection between emotional health and like chronic disease. There's got to be some kind of a connection.
Yeah, well, barring things like cerebral palsy, which is a genetic disorder that attacks the nervous system and the structure, most disease, according to traditional Chinese medicine and psychology, of which I studied both extensively, all disease begins with our emotions. So when we have, like we were talking about before, beliefs, if we have a lot of anger gets stored in the liver. A lot of grief gets stored in the lungs. Depression gets stored in the spleen. So different emotions get stored in the body in different ways and affect the organs in different ways. But when you really think about it, when I interview patients, they're behind all of their physical symptoms. There's something deep emotional going on.
Mhm.
There's like grief, there's pain, there's guilt, there's fear, there's, feelings of no self-worth or low self-esteem or failure or whatever it is that underlies every decision they make and leads them up to whatever physiological state of disease or, chronic condition that they have, in the present. So, yeah, big correlation there.
Okay. I figured that. I figured. Um, how do you listening to you, how do you help people regain hope after years of failed treatments?
Well, my testimonials kind of speak for themselves. So if you go on my website and look at the testimonial button and then click, we have page after page of video testimonials of people just saying, for 20 years, I had pain, gastric reflux or whatever. And in a couple of weeks, it's gone. So how do they have hope? Usually my patients will say, I prayed and this is where I found you. I prayed and this is where God sent me, or something like that. And by the time they come to see me, they already know my reputation. They know the kind of results we get. They've been referred by many people. They've seen many videos that I've done, or, information that I've written. So they're desperate. And I'm very confident. I am so confident because, like, I'm not going to say that if you have chronic debilitating disease that you're going to be 100% in a month. That's not what I'm saying. But there's not anybody who will not benefit from my guidance, because the things that I teach people help them spiritually, mentally, emotionally, physically, psychologically, in lifestyle, in some ways that have profound and dramatic impact, even if it's just shifting the way they think about something, or like, wow, I hate to say it, but I kind of can not read minds, but I kind of can sense people, and I can feel what they're feeling and thinking, and so it kind of makes me have quick rapport with people. Um, Not in a way where I'm thinking I know, but I can ascertain things from people, and when I bring something to their attention that was like, wow, so it gives them something to work on. And when people have something to work on, they have
Yeah,
something to live for. And
correct.
if they're just resigned, I'm in this wheelchair, there's nothing left. Like right now, I'm working with a guy who had a bad stroke. He can barely move. He walks in like this in the wheelchair. So I make him sit up. I make him move his hands. I make him, look at me and talk and, make expression with his face. And he's coming along. It's slow, but he looks forward to seeing me because he's actually looking up for a change instead of like this. And it's like, wow, I can see, you know? So there's every little way that it's possible to get better. I figure out where do we need to open the window for this person to start letting in the fresh air.
Okay, I like that. I like that. Um, I just want to go off topic with you. I kind of forewarned you. One of my favorite questions. So here goes. Excluding family or friends, somebody living or dead you'd like to spend a day with.
Me?
Yeah, you.
Well, I had a childhood sweetheart. His name was Keith. I met him in New York City when I was 4. He was the he was the grandson of my grandfather's second wife. So he was sort of like my cousin by marriage, but we were not related. And we met each other when he might have been 5, and I fell in love with them. And then we met again I was 14, and we've we're still in love with each other. And then he called me when he was in Columbia University to visit him, and I did. And then he invited me to, when he was in Austin for college, he wanted to be a musician. His parents wanted him to be an engineer. And so he struggled mentally. And he ended up going to psychiatrist because his parents were so hard on him to become an engineer, and he wanted to be a musician. So anyway, he had a hard bout emotionally with himself. But when he was in Austin, that's when he proposed to me. And so we were engaged. And then I went off to Portland, and he used to make music up on mountaintops and send me the video before we had cell phones, like, or take pictures and things. He ended up passing. So he passed. We don't know if he passed from a drug overdose or something like that, as he was he was just struggling because his parents wanted him to be someone that he wasn't, and that he didn't want to be. And he got in the hands of the psychiatrists, and it was one drug after another. I sat with him for 1 month trying to get him off Xanax every night, trucking him to, please don't take the Xanax. And but then it was like one drug after another they kept prescribing. So I would want to see him again.
Great story.
Of course, my mother passed when I was born. She was only 25.
Wow. Wow.
She died in the also in the hospital. And
Wow.
I've not, I guess she would be number one because I really never knew her,
Yeah.
but yeah, that's a whole nother story.
Another story. Wow. Um, wow. Okay. Back to work. What's your you kind of alluded to this. You almost answered already, but officially, what's your take on over-the-counter medications?
Well, I mean, if you look at them, like some of these Tylenols with the blue dye, or the Aleve that are like red and blue, you got to wonder what's in them. And then if you read the ingredients, it's disastrous, and what they do to your liver. And they're so easy to get addicted to, because you can go in and buy a container of 1,000 Tylenol and use it from now for the rest of your life, which I've had patients tell me they were on 20 Tylenol a day
Um,
for pain or this or that, or for 20 years, or so it's a disaster. It's a crime. That's what I think about it. It's no better than the aisles and aisles of Fritos and Cheetos and food coloring and all of that. It's
Oof.
a crime. It's a crime.
Yeah, it is. It is. Yeah, it's funny. I won't use the brand name, but I'll use acetaminophen, APAP, whatever. But being a former pharmacist, even going back, to the 70s when I was practicing, it scared the hell out of me because I would read the contraindications and I would read all that stuff and all the things it did to the liver. I mean, you just make one mistake and take too much, you can kind of shoot out your liver in one day.
I'll give you a quick story. When I first moved to Hawaii after my 12 years in medical school and my studies, came to Hawaii. I had to get a job, of course. I had to finish studying for my boards. I went back to acupuncture school, and was trying to start my practice, and it was pretty stressful. And but back then I lived on a lot of caffeine and sugar. And so I went to a well-meaning practitioner and was given the sleep remedy that's supposed to be for sleep. So it worked so well. So I took it. I took it for probably over a year. And then I went and I wasn't feeling well, so I had my labs run, and my liver enzymes were over 2,000, and they told me I was going to die. So I had a fatal liver disease from the side effect of this substance that was then recalled. I learned that it was recalled at like 2 weeks after my lab tests came back. And I said to myself, oh my God, this substance is being recalled for causing toxicity to the liver. Thank God I found out. But, it's a lot of things you have to be really
A
careful.
lot of things, a lot of things. It has its place. It has its place.
For short-term use.
Short-term use. Yep, yep.
But if something isn't helping you get well, like even the blood pressure medicine, if a blood pressure medicine worked, your blood pressure would go down, right? So that doesn't work because you have to be on it forever. Then you have to change the prescription and take two, and then you have to take three. So the stuff doesn't really work at lowering the blood pressure. It works at, symptomatically until the pressure goes up again.
Yeah.
So really, if we don't address the lifestyle and what's causing the high blood pressure, and I teach people all the time that you have to you're in control of your blood pressure and your last breath. And if you can't control your blood pressure with your breathing now, how are you going to stay alive when, the time comes? It's like we have to learn how to breathe and meditate so that we can control our own blood pressure and pulse rate.
A good segue. You almost touched on it before you even asked it, but what lifestyle shifts do you believe create the biggest impact in a life? I know what it's done for me. The intermittent fasting and the weight loss and the pressure and all this stuff comes down. But what other lifestyle shifts create big impacts?
The first thing is your belief system, the self-talk. Like with you, when you turn your life around, you believed in yourself, you talked to yourself, you just made a decision with yourself. But so many people, they talk negative to themselves, they call themselves fat, they call themselves lazy, they call themselves unmotivated, they're constantly, they feeling like a failure. And it doesn't help that they feel terrible because they're sick. So, in addition to working on lifestyle things like exercise, which we have to move our bodies, and even you don't have to go run a marathon, but you can move your body. You have to move your body in order to get the lymphatic fluid circulating. So, diet, but routines. Routines are crucial. So I think going to bed at 10 o'clock is important. Turning electronics off an hour or two before bed is crucial. Getting good night's sleep is crucial. However, you need to do that. Like, I mean, barring being on chronic meds, there are ways to, get to sleep without meds. And there are natural remedies, but sleep is so important. Getting up early, getting your routine, making sure to eat healthy food from the earth. These are all important things.
Agreed. Agreed. I mean, everything you're saying in my own little microcosmic world, it's real. I live it. I see it in my own world. What role, you also kind of hinted on it, what role does mindset, you just said it, what role does mindset play in the healing process?
Everything.
Everything.
It's are we going to have a good day or are we going to have a bad day? Are we going to make good choices or are we going to sabotage ourselves? It's, all about how you feel about yourself and what you say to yourself and decisions that you make. So mindset's huge. Intention is a big part of getting well. If you intend it, but then you have to follow through with action.
Okay. Do you have I'm curious. Oh, slightly off topic. Just curiosity. Could you see a patient from New Jersey
Oh,
through
yeah,
Zoom? What?
I do remote work.
You doing? Okay, I wanted to ask that. That's important.
Yeah.
Yep. Okay.
On the
That-
phone, get on FaceTime. It's easy nowadays.
Okay. It's funny. I did a thing with a clairvoyant. Um, I, not quite you, but I did a thing with a clairvoyant. My first time with that, and I was pretty cynical about it. How can somebody in Texas see into me? And she closed her eyes for 70 minutes, and she nailed me. She was able to tell me things about myself that not even my wife out there in the kitchen knew. And she wasn't using glittering generalities. She didn't say, "Hey, you're gonna have a bad day next week," because everybody has a bad day next week, you know. But she nailed me. So I was impressed with her powers of seeing me. And so when I asked you that question, it's the same thing. You have the powers to see and put things together. So that
Yeah,
was, of
I do like to have a visual. So if
course,
someone doesn't want to do FaceTime or Zoom, I ask them to please send me some photos because I can see a lot from looking at someone's complexion, their tongue, their skin tone, their body composition,
interesting.
can tell me a lot,
So
you know.
interesting, Diana. I know it is. Um, what's your just out of curiosity, how does the doctor do a personal daily wellness routine? What is your personal daily routine?
Well, I'm a voracious reader, so I I love to read, and by reading is like also a natural sleeping pill because after a few pages or an hour, it depends how good the book is and how tired I am, but when you read, your eyes naturally get tired. So I have a habit of journaling before bed. I read before bed. I like to and I play the piano. So I like to play the piano every day. So when I do those things before bed, I feel like I had a good day because those are things that I do for me. And most of the day I'm doing, but also part of my routine. I get up at 5 o'clock, I meditate, I go to the gym or I go out to nature, I do some movement, I come back, I make a nice smoothie, I eat good food, I do well, I do my best to stop working by like 6:30, 7, I do my best. Take some me time, spend time with friends, spend time with community. I have community workshops here every week or every month rather, here in the center. And then I also have we do grounding and things like that in nature, but I also have a community that I bring together online every other month. And so I do things that are enjoyable and that give me purpose and that make me feel like I am sharing my wealth of knowledge. I have so much that I just want to give it away while I'm alive. And yeah, so I have a fulfilling life, and then I see patients all day, I run my own center, so I'm, taking care of my staff and my employees, and but I have a good balanced routine, pretty balanced for me.
In the Garden of Eden over there. Wonderful place.
Yeah.
Like no place that I've ever been. Uh, truly. Uh, so uh, we're done with the crux of some of the things I wanted to ask you, but we were talking about never before in the history of mankind have issues, and you can just comment on this. We talked about it before we went on air, how critically important it is in the things that you're doing in the whole panoply of health, naturopathic medicine. I mean, all of this, we as a species, because this channel is called Conversation with Calvin, we the species, we're running into problems on both sides, on both genders, with fertility, and a lot of that is environmental related. And do you handle those kind of things in your practice?
Do, absolutely. So, one of my colleagues has created some nice formulations, both for men and women, that helps with fertility. So, the right blend of the right herbs. And, but of course, I have equipment in my clinic that I can test people to know what all's going on. But yeah, we definitely work with fertility. Plus, I do acupuncture, and that can help with fertility. But the counseling on the lifestyle and all of that matters. And typically I have to remind women that trying to get pregnant is the last thing they should be doing. Because when we're trying and we're that urgent and we're intense about it and we're stressed about it and trying to time everything, and typically people are too stressed out nowadays.
And
you
that
know
affects.
Stress affects it a lot. That's why people, a lot of times, they go on vacation and they get pregnant because they're relaxed. But you have to take all that pressure off of yourself, because having getting pregnant is it's a God thing, as far as
Yeah.
I'm concerned. And I had both of my kids in my 40s, and I never had any concern about would I have babies. I was like, if I don't meet someone, I'll just go adopt from China. I had planned to adopt two kids from China, but I ended up meeting someone, having two kids in my 40s without any help from anything. But nowadays, with all, we were talking about the microplastics, and it's affecting the reproductive system, and those COVID shots did not help at all, and they're affecting fertility, the side effects of that. So there's a lot of things right now in our environment that are affecting people's fertility.
Yeah, yeah. No, I wrote it. I always plug. There's a tortoise in my hair. My book. There's a whole bunch of stuff about this character's journey through fertility and infertility, and journey to become a parent. Uh, um, and I just learned the other day that some countries out there in this world of ours that are approaching zero population growth. So, and a lot of that is microplastics and environment, and we as a species, we better start dealing with that kind of stuff. But that's interesting that you do that kind of work, because it's really important, truly. So, you know what? We could talk for hours. You don't have hours. Well, you do. It's still early in the afternoon where you are. But uh, I thank you for this, Diana, for your graciousness and your time, your passion, your energy, your knowledge. And hey, if you ever want to come back here, come back. We can do some more. I mean, it's never ending, the things that we can talk about, and it's relevant. And I'm glad to hear for my viewers here on the East Coast that you can. It's because what you do works. It just works.
Does work.
It does work. So thank you so much for being here. Aloha and stuff. And I'm gonna sign off now. Don't leave. I'm just gonna stop recording. But again, thank you so much, Diana.
Pleasure. Thanks, Calvin.